interacting with patients increases the patient-health worker relationship. And this is because our patients get to understand what illnesses they suffer from, what challenges they are going to face with that illnesses, what is the expected results on management of illnesses, some of the side effects of medication that patients are getting, and also patients get to understand their recovery process, whereby some patients fully recover, whereas others may stabilize, and others might have to live with their illnesses for a lifetime. And in today's video, we had a good time with our clients who get mental health services at our facility. They belong to our user group called Safe Minds, which is under NALONDO BUTTA Medical Foundation, which is our NGO, and our major aim is making the world a better place for everyone. As we interacted with our patients who get services from us this week, they asked, so our focus mainly targets non-communicable diseases. And this is because these illnesses always take a long term or a lifetime on management. And patients need to be sweet talked, psychoeducated, and counseled on their illnesses while with their own medications. And these include the few listed, which may be 1. Sickle cell disease, mental illnesses, for example, depression, bipolar, schizophrenia, or any other anxiety and anxiety disorders, diabetes mellitus, cancers, hypertension, to mention but a few. However, when you are having our health talk this week, the patients asked the following questions. Number 1, what are non-communicable diseases? These are diseases which cannot be directly transmitted from one individual to another. For example, mental illness, hypertension, diabetes, sickle cell, chronic liver diseases, chronic kidney diseases, to mention but a few. Then question number 2, can accidents cause epilepsy? Yes. Accidents involving head and brain injury can cause epilepsy. And this is because if there is any damage on our brain, the damaged brain cells can be the onset of the epileptic seizures in patients facing some epileptic diseases. Question number 2, how many tests does an epileptic patient do? There are basically 2 tests which an epileptic patient can do. Number 1, EEG. This confirms the type of epilepsy. an individual has. And number two, an individual might do a CT scan depending on the attending physician. And this CT scan helps to look at the brain structure and identify which part of the brain is actually destroyed or affected, and other reasons. Question number 3. Can an epileptic patient be healed? Next question. One of our patients asked, can HIV cause mental illness? And this is an interesting question. HIV might not cause mental illness to every individual. But however, remember, HIV has 4 clinical stages. In case an HIV patient is not adhering to treatment, then the CD4 count goes low and the viral load goes high. And an individual can progress from clinical stage 1, clinical stage 2, to clinical stage 3 and clinical stage 4. So once CD4 count is below 200, then an individual is liable to developing HIV-induced psychosis, whereby an individual may experience either visual hallucinations, auditory hallucinations, or any other psychotic features suggestive of a mental disorder. Therefore, HIV, when not adherent to medication, can cause low CD4 count and an individual might get a psychotic episode. But the good news is it is manageable by giving ARV drugs and after antipsychotics, and good results are always gotten. And our last question, second last question is, does witchcraft cause mental illnesses? I'm a born of Uganda, and you hear of witchcraft and other myths concerning mental illnesses. But as per my own specialty, I'm a practicing clinician, and I believe on experience that most illnesses are caused due to medically confirmed reasons, which might be changes in neurotransmitters, certain infections, or certain disorders in our biochemical changes of the body. Therefore, I might not say no to witchcraft or traditional beliefs, but I stand on my own profession that most mental illnesses and other non-chemical diseases are caused by organic or brain chemical changes. And our last question is, for people who are having epilepsy and other mental illnesses, in case the symptoms stop, for example, in case the fits stop, or in case the psychotic behavior stop, is it okay to stop the medication? My advice is, each patient presents differently, either by diagnosis or by progression of the illness. And for this matter, therefore, most mental illnesses stabilize, and therefore a patient is liable to being on medication for a lifelong. Expect a few which are always acute and brief. These are the ones which normally treat, recover, and stop medication. But however, this depends on the attending clinician or physician. In case they identify that you need to be on a lifelong medication, then it's better you keep on lifelong medication for good. Remember to follow your doctor's treatment advice depending and according to your condition. Thank you and see you in our next videos.